Is your body ready for the summer? Well, there's a growing trend in plastic surgery, and not only women are doing it, but men. They want to look like Beckham, David Beckham. They want his chest, they want his nipples. That's right. I never looked at his nipples before, but now I'm interested. Anyway, how do you get those nipples? You have to go under the knife to get it. Here to tell us exactly what's going on in the cosmetic surgery world, Dr. Norman Rowe. He's a board-certified plastic surgeon with a practice here in New York and all over the place, really. Yeah. Nice to have you back, Dr. Rowe.
Thank you very much for having me.
So what's this obsession with Beckham's nipples?
Well, I think it's not necessarily, David Beckham's nipples. It's someone who wants to look great without a shirt. And as we head into summer, men are going to be taking their shirts off, or you're going to be at the beach. People want to get their beach bodies ready. And so if you think about it, your nipples are part of it. They want to look good because you're going to be bare-chested. All
right. I know you have before and after pictures of men who've gone under the knife and done this.
Right.
So what do you have to do to get those nipples?
Well, a lot of men have enlarged or hypertrophic nipples, and that's actual projection of nipples. So that when they wear a T-shirt, it kind of pokes through.
It pokes through. They don't like that.
They don't like that. Now, that's sort of just the opposite for women. They want just the opposite. A lot of women want nipple augmentations, but men want nipple reduction. So it's a relatively quick procedure. We do it in the office. It's under local anesthesia, almost no downtime, and you're ready to go to the beach in a couple, 3 days.
How much does that cost?
Somewhere around $5,000 to $6,000.
Okay, let's talk about something that women are doing because, we all like those sleeveless blouses, and there's not enough exercises that you can do to get rid of the bat wings.
Correct.
So what are women doing now?
Well, that usually requires some sort of surgery, and to be perfectly honest, I'm starting to see a lot more of that with the Ozempic and with the weight loss medications. Women and men are losing weight, and they're getting the bat wings.
They're getting, because it's just the skin
the weight
falls.
just falls off, and the skin just kind of hangs. And people ask me, can I go to the gym and work it out? Now, going to the gym is great. It's great for your heart and what have you, but you can work out all you want, but you're not going to get rid of the bat wings. The only way to really get rid of that is through surgery.
All right, so what did you do here?
That's called a brachioplasty, and that's arm surgery where we make an incision in the armpit. We do liposuction to get rid of whatever fat we can, and then we take care of and excise the excess skin in order to tighten up the arms so they don't have bat wings.
So what kind of downtime? I mean, can you lift up your arms after that?
Downtime is about 10 days, 2 weeks. There is a little bit of swelling. I always tell my patients your forearms and your fingers are going to look a little swollen, almost like fingers are going to look like sausages for about 2 weeks, but after that you're back to normal and the bat wings are gone forever.
But what about the line on the arm?
It depends. If someone has very bad skin, a lot of extra skin, then sometimes we do add an incision down the arm. In some instances we do a limited incision brachioplasty, which is this armpit alone. So it really depends on the severity of how much excess skin they have. But to be perfectly honest, most women will agree, and men who get this done, they'd rather have the scar than the bat wings.
Interesting. How much?
That roughly about the same, about $5,000 to $6,000.
But there is more downtime.
There's a little bit. There's a couple weeks, to be honest.
Gotcha. All right. I see you brought a fancy machine here. What's this?
This is True Sculpt. This is a laser fat reduction machine. It works for someone who has a little pressed for time, has no downtime,
and doesn't want to go under the knife.
Doesn't want to go under the knife. Doesn't want to take the couple weeks off. What this is radio frequency. These probes are taken off and attached to various areas of the body, and in 15-20 minutes it removes 25% of the excess fat, and in addition it tightens the skin.
Did it work
exactly
yet?
what it does.
I don't think so.
The probes are very popular.
You don't have this on. I didn't feel anything.
The very popular one is for the neck, for the turkey gobbler. So a lot of women, a lot of men love that. And
you really see a difference?
25% fat reduction and skin tightening after 15 minutes. The neck takes about 2 or 3 treatments to kind of get that. The rest of these are placed anywhere. Man, in the summer, you're putting it around your, we're treating the love handles. Women, the medial thighs, bra line where their bikini lines are, and with straps so they don't have hanging skin there. Takes about 20 minutes. Some people come back about a month later and they'll get another treatment, so now you're up to 50% fat reduction. Just to be honest, this machine is really designed for someone who's got that spot area of a little excess fat that you just can't get rid of in the gym. If someone comes in and they have kind of fat everywhere, that's more of liposuction, or you need to go to the gym and weight loss. But this is great for spot areas that you just want to get ready, especially as we head towards Memorial Day.
All right, how much?
That runs about $3,000.
And I'm sure there are risks to everything, right?
Very few risks. I mean, the risk that everyone always asks me about is the same one as for that machine, True Sculpt, which can cause PAH, which is paradoxical fat enlargement. There's no risk with that, with this. So very, very few risks. The only risk you have is you might have to go buy a whole new wardrobe.
Why am I so intrigued, Dr. Rowe? Where can people find you?
They can find me at roweplasticsurgery.com or normanrowemd.com. We have offices in New York City, Long Island, New Jersey, and Florida.
Nice. Even in Florida. Everybody's going down to Florida, Dr. Norman Rowe.
Everyone loves it. This machine is pretty much going around the clock in Florida because it's a very outdoor community. But as we head into the summer, this is a very popular machine.
Dr. Rowe, thank you so much.
Always a
Appreciate
pleasure.
it.
Thank you.